Schools reopening should not be a politicized topic. We should let science guide us to make the best possible decision. It's not going to be a perfect one, but it's going to be the best one we can do in our given situation and adapt as we go. Here I sit down with Dr. David Epstein to talk about schools reopening, who's a pediatric ICU physician who also works in a pediatric urgent care right on the front lines during COVID-19. Enjoy. Dr. Epstein, I want to welcome you to the channel. Tell me your background. Tell me why you would be one of the best people, if not the best person, to talk about this subject.
Well, thank you, Dr. Varshavsky. I really appreciate you inviting me to the conversation. I'm boarded in pediatrics, and I did subspecialty training in pediatric critical care medicine. I worked a few years at UCLA, and then worked about 14 years at Children's Hospital Los Angeles in the cardiac thoracic ICU there. And over the last 5 years, I've opened up a pediatric urgent care in which we've been caring for children on the front lines with urgent care needs. So being exposed to a lot of variety of illness in pediatrics, from those that are minor to those that are quite life-threatening.
Since we're going to be talking about the subject of schools reopening, I guess the first thought that everyone has is, are children going to be safe because they're going to be exposed to other children who potentially could be spreading this virus?
California in general, maybe about 8 or 9% of the total positive population has been children.
I want to make a statement, and you correct me if you think it's wrong, or perhaps you'll agree with me. If I had a 5-year-old child and I was faced with this very weird hypothetical situation where I had to choose between them getting the influenza virus or COVID-19, I think I would want my child to get COVID-19 because statistically, at least right now, it looks like they fare better with the virus. Would you agree?
Of the kids less than 17 years of age, California hasn't documented any deaths less than 17 years of age. Most of the deaths have been in the population greater than 65 years of age. So I have to think of it in terms of morbidity and mortality and things like that. And so from a mortality standpoint, it seems like, kids, the population, it seems to be almost negligible as far as mortality. When you talk about kids who die from influenza, that seems to be a very rare event as well. I mean, I think annually there's probably about 180 kids that die from influenza per year. And I'm sure the national numbers for kids dying from COVID is not negligible. I'm sure that, there are a number of cases. So you're trying to balance that. The concern is, and the anxiety is that you have a vaccine for influenza, you have treatment for influenza, and you're still only having, you're still having a mortality of 186 children, which you feel is kind of more preventable. When you're talking about COVID, you don't have any of that safety net as far as treatment or vaccine. I think the anxiety of not knowing what could happen is an issue, because we're worried about, kids who may have underlying illnesses like juvenile idiopathic arthritis, or they may have some other immunodeficiency, or they may be immunocompromised, and they may not show up on the mortality board, but they may show up on the morbidity board of getting more severe disease and having issues with their medications and having them step back. While the numbers don't look bad as far as mortality and contagion and having kids passing along to adults, I think some anecdotal reports have said that maybe the index case of children passing to adults is probably 9% or something like that. And so they don't seem to be passing it along for, the young kids.
I think your answer is very fair, that we don't know what that answer is. We can lean one way or another in the moment looking at the current evidence. That may shift as more evidence comes out. Because, for example, we see this low index number that you mentioned, which is this how easily children spread this virus. And we think, okay, maybe they're not spreading it as much. We see the lower number of that multi-inflammatory syndrome being not so high. And we think, okay, not so bad. But did those radically change when we go back to school? Very possible, right?
Yeah, and we don't know that yet. And I think a lot of countries around the world are going back to school in various forms or fashions. But we have to think that we're looking at something that's only gone over months. And the information we have on influenza is years. In the ICU, we like to know what we're dealing with. We don't like to know about the unknown. And so having that things be a little bit more concrete and known is a little bit more comforting to us. We're control freaks.
As physicians, we oftentimes have to make recommendations with limited evidence. That happens quite often. A B or C level recommendation, and we have to give that to our patients because that's what we know in a given moment. What I think is going to happen is, in some way, we're going to return back to school or return back to normal, and we have to be flexible enough and adaptable enough to pivot at any given moment. That's why in my stance, it makes sense to either A, delay school until we have more information and not be hard set by these deadlines where, by August 7th, we have to have a decision. Well, if we don't have the good info to guide us then, maybe we can push that a few weeks and see what happens, because ultimately we're trying to play this game of risks and balances without all the cards on the table. And perhaps if we buy ourselves 2 weeks, if we allow a study to be finished, we'll be able to make a better decision for schools, for parents, for teachers, all of the above. What are your thoughts on teacher safety and all of the conversation that's surrounding teachers being safe around children in COVID-19 era?
I think in general, pediatricians are in favor of going back to school in some form or fashion. While we take into account the pediatric standpoint, oftentimes I think we forget about the teachers who are the adults in the classroom, and different countries around the world have had some experience. And I know we hear about Israel and Germany, and in Israel there was a lot of contagion and they had to shut back down, and there were teachers who were affected and kids. In Germany, I think there was less so. I think it was more spread by children and or spread amongst kids and not so much staff. Every country seems to be a little bit different. I think that we're still learning. And I do think that the teachers have a voice in all this because it's their lives that are online, and some of them may be elderly.
We have to be honest and talk about the disparities in socioeconomic factors, that some schools are dealing with a lot less resources than others. I've been my entire childhood, I've went to inner city schools, and I've seen how they've had to manage with low resources. And I can't imagine some of these things that are on the CDC checklist being accomplished. While I think it's great and the CDC put out the correct recommendations, just from a realistic standpoint, where are you going to get these employees that are going to be doing contact tracing? Where are you going to be getting substitute teachers from when teachers who are elderly can't come in, or when someone has an immunocompromised state, or checking on students who didn't come in because their parents are sick? There's so many variables that it's impossible to get a perfect scenario. So we have to lose that idea of perfection right away and be open to this nuanced conversation where perhaps there's not a one-size-fits-all solution, especially on a geographic level. Like what works in an area where there's low infectivity versus where it's peaking has to be completely different. I want to ask you a pointed, very difficult question. What is your stance on schools reopening?
Yeah, no, I think that's a very good question, and something that I've been thinking about a lot because I have school-age children, and they're going back, need to go back to school, and I vote for going back to school. Bottom line.
For what reasons specifically?
Okay, well, this is good. So I agree with everything that you said, in as much as every area of the country is going to be different. What works in the middle of Montana is not going to work in the middle of Los Angeles, or Los Angeles County. So there are different geographic areas. There are different places that have different incidents of disease, and so the precautions will likely be different, and we have to shape those accordingly. And like you said, there are disparities in districts, and it's going to be hard to accommodate all those recommendations, which are the right thing. The reason why I believe that kids need to be going back to school, the important things are the education. And I know that in some districts, they may not have the ability to do remote learning, teleeducation, those kind of things as adequately as other areas. The other things are just the socialization of children. Children respond and map out their world depending on the contacts they make. Right now, we're creating a two-dimensional environment for our kids and for us. And really, as human beings, we develop in a three-dimensional world with that contact with other people, those exchanges, those kind of things. And it's very difficult for kids because their learning and their development depends on that. And you look at, one of the things that I've seen in the clinic is seeing people, adolescents, and this was near the end of the school year, having physical manifestations of their anxiety, their depression, their isolation from their peers, not being able to go to prom, not being able to graduate with their peers, not be able to interact in this most important milestone of their lives. And granted, at that time, that's a very, very important thing in their life. And so going back to school means a lot of those things. And not going back to school in isolation it promotes it's almost like a traumatic event. The educational aspects, the trauma that develops from isolation, I think those are very, very real concerns. Obviously, we have to balance this with the medical aspects. And as a physician, I'm extremely torn because I know the potential, and having worked in the ICU and being in the clinic and hearing about what New York went through, I have images in my mind and understand how severe things can get. And so trying to balance those issues with the issues of children not going back to school, it's a very, very real thing. But I do advocate for going back to school. But you mentioned one important word in your explanation of why you felt going back to school was important, or how to go back to school, and that's the word pivot. And I really like that term because we have to be flexible and we have to reassess. It's like the plan, do, study, act cycle, of quality improvement. I mean, we have to assess what we've done and we have to modify depending on what the outcome is. And so it shouldn't be, like you said, a very concrete, yes at all costs, no at all costs. It has to be somewhere in between.
I completely agree with you on the topic of opening schools. At the same time, if I'm a teacher and I'm elderly or I'm not elderly, or I have someone in my home that's elderly and I want to teach, it sounds like you're saying the children's social, educational development is more important than my safety. How would you respond to that? And I'm strictly playing devil's advocate here.
That's a very hard thing. I mean, I wouldn't want to put teachers' lives at risk by any means. There's going to be more data as time goes. I would hope that schools would find a way to be able to pivot or be able to do things in a way that can make it safe for teachers. But I do think it's important for kids to go back to school. And, maybe if it is, some form of, mixed teleeducation, live education. I know that a lot of countries and a lot of schools that have been planning pods, and shifts of when kids go back. So you're creating smaller environments, creating more distancing, having kids wearing masks, creating, regular hand washing, screening kids by, temperature, although that's not always accurate. Having kids sit out who have been sick.
Unfortunately, we're forced to be in a position of choosing the lesser of two evils, almost like a rationing of care situation, which we obviously hate in the healthcare space. Basically, rationing of care is when you have two patients and you only have one ventilator and you have to make the choice who's more likely to benefit from this. That's almost what we're doing when we're saying, should we open schools or not? Because we see the detrimental effects to kids on a mega scale, and we see the potential risk for teachers, because at this moment it's a potential risk. We don't know it for certain because we don't have the data to back that up. So we're sort of saying, okay, look, there is this potential danger, but we know this other danger for children most definitely exists. So let's start up in a gradual approach and build up and continually reassess our strategies. Will teachers have negative outcomes from this? To some degree, yes. We have to be honest about it. Will teachers catch COVID-19 if schools reopen? Yes. We just have to say that. Saying anything otherwise is a lie. As our federal leaders go on television, if they just say, oh, it's no big deal, no one's going to suffer, that's a lie. The approach that I feel has worked best for me in the healthcare space has been the most upfront that you can be with what you're doing, why you're doing it, and how you will pivot if information changes. And once you can get the people who you're treating, in this situation teachers, on the same page as to why you're making these decisions, the more likely they are to accept the outcome. And I feel that the federal government, the media, has done a really poor job arming teachers with good information about what risks they face, what mitigation strategies they can use, because some of the things listed in the CDC manuals are just impossible for many school districts. Like the 6-foot rule is great. It's not even a perfect rule, but it's not realistic for many schools. So perhaps we need to downgrade to the 3-foot rule that the WHO set forth. Perhaps we can move some classrooms outdoors where we see less transmission. There's all these things that are being pushed aside of the conversation in favor of a political talking point that really should not be anywhere in this discussion. Politics should mean the least when it comes to opening schools. Because at the end of the day, whether you're an independent, Republican, Democrat, your child is your child. And if you have a family member that has children or has a teacher in their family, you should care equally for them.
Communication is really important. And I think communication with teachers is going to be ultimately important. And trying to educate them with regards to what information we have on COVID right now, which, like you said, it's very imperfect and we're still learning and we need to reassess. But I think to have two groups suffer needlessly, children and teachers, is wrong. I think, and we have to balance each of their needs, and we have to reassess. I mean, it has to be a very balanced approach.
Let's take some time and talk about the outliers in this situation. We've mentioned social determinants of health. We mentioned lower socioeconomic school districts. There's schools out there that receive funding from property taxes in very wealthy neighborhoods that can, put acrylic across. Acrylic is that plastic see-through covering you see in some of the stores and medical offices. They could put that across the entire classroom. And then there's some areas where that's going to be completely impossible. There's some areas where students rely on school for feeding their children. Some areas that require the schools so that they can get to work themselves because they don't have childcare options available to them. Unless we bring all of these very important pieces of the conversation to the table, we're going to be leaving a significant population in the US behind. And that's not good either. I can easily see two individuals on this subject. A teacher on one end who's immunocompromised and is worried about going back to school. And at the same time, I could see a parent in a low socioeconomic neighborhood of a special needs child saying, I need my child to go back to school. I can't care for them without going broke because I need to go to work, or I don't have the ability to teach them because I'm not trained in this. And both sides are right in what they're saying. They both need to be heard. But where do you go from there? That's where I struggle myself even at times.
Well, I don't think you're alone. I mean, I think the whole country is struggling with that. I think there are a lot of people. I mean, if it was easy, we wouldn't be having these discussions. I mean, really, we wouldn't if everything was going the way it should be going. But there are a lot of competing demands, and trying to prioritize one over another sometimes is very difficult. But we do have to invest in our children, and the children are our future.
People watch this conversation, you and I speak. They understand where both you and I are coming from. What is the one line you want to leave them with?
Yeah, the things that we're doing aren't hard to prevent this. And the one thing that if we work together, we're going to get through this a lot easier and a lot quicker. And so if you're wearing a mask, if you're doing simple things like trying to distance yourself, washing your hands, not touching your face, staying away if you have cold symptoms. These are very, very simple things to do. There's a lot of controversy surrounding these topics and a lot of pushback on doing certain things because it's not what we're used to. It's not what we feel comfortable with. This is going to be something that's transient. And the time that we invest now on prevention and spread, it's going to pay off in dividends in the future because we'll be able to go back to work sooner. We'll be able to be comfortable with having our kids in school sooner without restrictions. There's a lot of things. So the sooner that we can implement these things and be more work as a team, we're going to get through this a lot quicker.
Check out this great interview with the psychologist who talks about good intentions having bad outcomes. Or check out me hanging out with my man, Dr. Fauci. Click it. And as always, stay happy and healthy.